So Petro, you mentioned to us that the McKenzie Method has completely changed the way you practice. In what way has it changed how you practice?
So the assessment, firstly, it really helps. There's an evidence-based way that you can assess each patient. So it gives you a clear guideline of how to assess patients, especially patients that in general would be quite difficult to get to a specific diagnosis. So it's very clear, and it helps a lot with that. And I think that's the most important thing. If you can first assess a patient properly, then you know how to treat them properly. There's no way that you can know how to manage someone if you don't know what is wrong with them. So that is extremely important. I think that's the main thing for me. I would say for spinal patients and the extremity patients, that is completely changed that. And then what is so great about that is there's very specific ways that you then treat them safely, and a system how you can progress those treatments. Again, there's a good way of how you can show them then how to return to their normal function and make sure that this doesn't reoccur.
And you make a point of saying, Petro, that sounds like we don't just use the traffic light guide for education of clinicians. You find it very helpful in educating your patients, it sounds like.
I think it's a very clear guideline that shows patients when they need to stop. So when something is not right, in other words, and when they need to seek help again from you. But it also tells them when they can go on. So there's specific things that they can look on that they know is safe. They can continue, even though the symptoms might seem a bit different to them. It's actually a positive response which you are looking for, and they need to continue doing that specific exercise or that specific prescription that you gave them. And then it also helps us to better identify when we need to change it or try something different. So I think it's a very nice guideline that helps the clinician and the patient.
So, Petro, you were stating specifically that the pain can be different, so they're experiencing a different pain. You're referring to centralization and peripheralization.
That's 100% correct. So that also helps if a patient gets a green light, so that means they need to continue what they're doing. Sometimes you get a symptom that's in a different location of where the pain started. So the pain is no longer in the peripheral joint, it's now actually moving up closer to the origin. So it's in a different location and it feels different to the original pain. It might be alarming originally to the patient because I don't know, can they continue, the pain has shifted now, but to educate them and then to tell them that that's actually what you want. You want the pain to move closer to the origin, closer to the spine. That actually helps to tell them it's safe, they can go on. That's the response you are looking for, and of course that's what we refer to as centralization.
So Petro, and we keep on mentioning education, so it does sound like, in your opinion, it's a big focus.
I think it's extremely important to educate patients properly so that they know what to look out for, how to self-manage, and to get them back to their highest functional level so that they know exactly what they can do themselves and what to look out for to know when they need to seek help. So education is extremely important.
So Petro, we keep on mentioning, and it's now the second time we've mentioned education through this interview. It sounds like that's a big point of focus, isn't it?
Yeah, and I think for me it's absolutely incredible. I'm just so thankful that I had the opportunity to do these courses, because it has completely changed everything for me. The main tool that I got out of it is how to properly educate patients so that they can get back to their highest functional level, which is what every therapist wants for their patient. And to see a patient that was in pain for such a long time and then being able to properly reduce that pain, or somebody that couldn't do an activity which they love doing for a prolonged period, and then get them back to being able to do that, and to educate them and show them how they can do it and how they can self-manage and to prevent a reoccurrence of that. It's incredible.
Thank you, Petro.
Thank you.